What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we'll cover the X-ray tech workload in school. So typically, depending on the type of semester you're in, you can kind of see two types of breaks. You will cover like the beginning, your first semester versus kind of your second semester, where you add clinicals into the mix of stuff. So, to give you context, I am an X-ray tech. I've been doing it for 2 years. I do night shift at a trauma 3 ER. So, school-wise, I would say the first semester, your main focus is in the classroom, learning how to do positioning via patient care work, via like trying to get the hands-on stuff to learn how to actually be later on into the next semester into clinicals. And then there's some programs that as soon as you start the program, you actually do clinicals the same, but you're limited to, depending every week. If like you start off learning the chest the first week, you can only do chest x-rays in your wherever clinical site. So that's a different ball game. In my program, it was first we learned how to do everything, and then the next semester was clinicals. So for the most part, you'll be learning how to position patients, giving homework over that, over the anatomy, how the bones are supposed to look like, and how to know how optimal the view is to know if it's acceptable for the rad so you don't get in trouble. Or you learn how to do trauma positions type cross table and stuff. So if the patient can't be positioned optimal, you have a few options. As far as workload, I would say usually you have like during the week, you start off with your lesson plan, you do that, a few PowerPoints, you go home, you usually have some reading over the chapter, and then maybe like some quizzes to go along or some fill in the blanks type deal they'll have you do. And typically almost every other week you'll have an exam over something, or especially for the positioning, every other week, well, not usually every week, you'll have a different quote unquote like comps or like do checkoffs at your school where you'll pretend to position a patient, well, your partner, whoever that is, into whatever position they want you to do, and you'll shoot them. So some of the time you'll be spent studying in the labs or the clinical type mock clinical things. That's will take up a good chunk of your time. And then you have studying like for quizzes and stuff, or for exams. That will be the main part, which is the most dominant, because sometimes you'll have to juggle between one class and another class because they'll stack their exams the same day. I mean, they don't mean to, but it'll happen. And then you'll feel sometimes really stressed the first semester because you're trying to get a hang of everything, trying to juggle things. And then the next semester, on top of all the other stuff you have going on, they just got to squeeze in the clinicals in it. And that right there, depending on where you are at in clinicals, will throw a whole nother little variable, because it's like, okay, you got to be there at 7 or 8, whatever. And if it's far, you got to give up more sleep because you got to wake up early to prepare and drive. And if you're new, you're probably going to try to remember your positionings, look over your little textbooks type deal. And then you get out like at 3 or 4, depending where you are. And then if you got to drive, probably like an hour at most. Most places make you drive an hour at max, distance. That adds, like literally all that adds, think about it, not adds into, you could have been studying, or you could have been like, it all drains your battery. Like it all takes a toll on you. And usually you go to clinicals, I think the first semester is like twice a week, And then later on, it's like 3 times a week during the summertime. So you'll have that going on. And then usually in the summertime, when you're going more heavily into clinicals, you'll just be going to clinicals in certain places. So when you just focus on clinicals, it's pretty easy. It's like almost like if you were working, because you don't really have to worry about many school stuff. It's just like, oh, did you comp something? Document it. Oh, your little journal of what you did or how your experience in clinicals is. Pretty simple, pretty basic. So that semester more better. And then as you progress, you may slowly start focusing on what's going to be on boards and stuff like that. But for the most part, you will have to kind of give up your social life. Unless you're one of them Sheldon people that are really smart, then you're a different boat. But for us normal people, you will have to give up socializing because you're focused so much on school. And since they have higher levels of standard, aka you have to make a higher grade to pass, you're always trying to get the highest grade possible. So if something happens and you don't do good on certain tests, it doesn't bump you all the way down. Because once you're down and you're trying to climb back up, becomes way more stressful, way more harder. Yeah, but yeah, hope that gives you an insight of what to expect in far of the program, and I'll keep on making more videos to educate the peeps. Yeah, it's been your boy Miguel. See ya on the next one.